Good afternoon, everyone. I am Jim Ryan, president of UVA. Welcome to all of you, and thanks for joining us. This has been a hard week that comes after almost a year of dealing with a difficult and relentless pandemic. I appreciate all of you taking the time to be here, and I hope this hour will provide a chance to share some important information about where we are with the virus and to answer as many questions as we can. As a reminder, please submit any questions you have to the Q&A function at the bottom of your screen, and we will try to get to as many, as I said, as we can. Before I share a few thoughts, I'd like to introduce my colleagues who are joining us this afternoon. Dr. Mitch Rosner is the chair of the Department of Medicine and oversees our infectious disease division. Dr. Kosi Sifri is the director of hospital epidemiology at UVA, and along with Dr. Rosner, has been leading our COVID response from the very beginning. Mitch and Kosi will speak about the virus in just a moment and will help answer questions at the end. The remainder of my colleagues who are on the screen are here to answer questions, and they are Liz McGill, our provost, who is essentially the number 2 at the university and is in charge of the university's academic mission, including teaching, learning, and research. JJ Davis is our Chief Operating Officer. She oversees the teams that help keep the university running and who work hard to make sure we're staying safe and healthy during the pandemic and otherwise. Dr. Tyson Bell is Assistant Professor of Medicine in the Divisions of Infectious Diseases and International Health and Pulmonary and Critical Care Medicine at UVA. He's also the Director of the Medical Intensive Care Unit and the co-chair of the recently formed advisory group on vaccines, which is why we've invited him here today in case you have some questions about that group and vaccines in general. He can help answer them. Alan Groves is the Dean of Students and oversees all student housing and student gathering spaces, as well as student engagement and multicultural student services. So let me talk a little bit about how we got here and what we know before I turn it over. As you heard, undoubtedly, on Tuesday, we enacted temporary restrictions designed to slow the spread of the virus that causes COVID-19. Our hope is to lift these restrictions by the end of next week, but that will depend on what we see over the next several days. We took these actions because starting last week, we began to see a troubling and unusually large rise in cases among our students compared to the fall. We wrote about this increase and the possibility of new restrictions in our weekly update email last Thursday, in part because we recognized how difficult new restrictions would be on everyone, especially our students. Over the weekend and into Monday, cases continued to rise. They were widespread across grounds and off grounds, and the positivity rate was increasing. So we made the decision on Tuesday that we had to move and that we had to move quickly. It was Mardi Gras. The next day was a day off from classes, and we thought students would be getting together that night. This was not a decision we made lightly, and it was a decision informed by the unanimous advice of our medical experts, including Drs. Rosner and Sifri. We have been following their advice from the outset, which has been based on daily analysis of testing results and what we're learning from contact tracing and what we're seeing around the Commonwealth and around the country. They've made and continue to make real-time recommendations about our responses, including at a daily meeting of an epidemiology working group, and they've been in the room with senior university leadership for every major decision. I know the news on Tuesday might have caught some of you by surprise, and I'm sorry that we weren't able to provide more notice. But as I said, we felt we needed to act quickly. I know there are also a lot of questions and speculation about the cause of the current spike. Dr. Rosner will talk a little bit more about this. But let me say that the positive cases so far have been distributed across the entire student population and include students living both on grounds and off grounds, undergraduate and graduate students, and students affiliated with a large range of groups. Dr. Rosner will show you a map in a minute that will give you a better sense of the distribution. Dr. Rosner, Dr. Sifri, and others have worked hard over the last several days to pinpoint causes and sources, including through conversations and focus groups with students who have tested positive. Here's what we've learned so far. First, the rise in cases doesn't appear to be due to a particular variant of the virus, nor due to a particular group of people not following the rules. Instead, case trends suggest that many students on and off grounds were not adhering to health and safety protocols as closely as we've asked. I say this not to point fingers or to shift blame, but to state the facts. This doesn't mean that all students who contracted the virus were being intentional scofflaws, flouting the restrictions. Instead, the picture is a lot more complicated, with some students who were undoubtedly ignoring health and safety protocols and others who made innocent and understandable mistakes or simply let their guards down, as many of us, if we're honest, myself included, have done over the course of the last year. The point to emphasize is that it may be tempting to think that this spike has all been caused by willful violations among individuals or groups. Some were willful violations for sure, and where we've had evidence of those, we've imposed and will continue to impose sanctions through the Dean's Office and through the University Judiciary Committee, who have had to bear more burden than most and for whose work we all owe a debt of gratitude. There's also a narrative that the spike is due entirely or predominantly to rush events for fraternities and sororities. There's no doubt that rush contributed to this, in part because it brought groups of people together. There's also no doubt that mistakes were made, as were willful violations in the context of rush. And I'll talk a little bit more about this in a second. At the same time, however, there's no doubt that there were dozens, if not hundreds, of other interactions completely outside the context of rush that contributed to the increase in cases. Some involved willful violations, as I mentioned, but some involved innocent mistakes, like taking off masks while eating inside and sitting too closely together with other people. The important point to emphasize is this: we should beware of and reject a single simplistic narrative where there's one villain or one villainous group to blame. The fact is that there are multiple causes across a range of groups and individuals. Some were willful and others far more innocent. As leaders of the university, I wish we had been able to prevent this spike, and I'm sorry we weren't. We have, from the very beginning, been trying to hit the right balance in terms of aggressive monitoring enforcement on the one hand and trusting students on the other. We knew that if we went too far or were too aggressive, it would feel like we were living in a totalitarian state and had contravened our foundational culture of trusting students to govern themselves. If we did nothing, on the other hand, it would seem like we were condoning violations or just looking the other way. So we've tried to hit the right balance between these extremes. We've been monitoring through the ambassadors and have a reporting system, and we have, through the Dean's Office and the UJC, imposed sanctions on individuals and groups alike. Have we always hit the right balance? No. At times we have, at other times we haven't. I will say that we are constantly reassessing this balance and will continue to do so, but it's hard to get it right all the time. And where we have gotten it wrong, I apologize. We're working hard. We are trying to make the right decisions based on the information we have and the advice of our experts, but we're far from perfect. Let me say a few words specifically about rush, as I know it's a subject of a great deal of conversation and controversy. The university's health and safety restrictions, including limits on the size of gatherings, apply to all students and all student gatherings, including those of Greek organizations. What that also means is that students involved in those independent groups retain the same rights as other students under our policies. We couldn't have imposed an all-out ban on in-person recruitment events without applying similar bans to other gatherings. Faced with that reality, our Dean's Office was in frequent communication with leaders of Greek organizations ahead of recruitment to urge that as much as possible be done remotely, and to underscore that any in-person activities the groups decided to conduct had to comply fully with the university's COVID policy, including limits on any gatherings to no more than 6 people. We also took precautionary measures by enlisting additional help from ambassadors and university police to monitor activity at Greek houses on the corner and on the grounds. University police supervisors were provided Dean Grove's cell phone number to call if an officer observed any gathering that appeared to violate policy, so the university could respond immediately. That's not to say that all of these efforts work. We know of some violations and we still may learn of others, and we won't hesitate to respond if we do. But this wasn't a situation, I should emphasize, where a certain group was given special treatment. In hindsight, perhaps we should have tried harder to discourage all in-person rush events. It may seem obvious at this point that there would be violations, and we might seem somewhere between clueless and naive to have thought otherwise. I get that. But this was another situation where we were trying sincerely to strike the right balance between freedom and trust on the one hand and complete control on the other. If we got that balance wrong, I'm sorry, and please lay the blame at my feet as I'm ultimately responsible. So where do we go from here? We're at the point in case numbers, I should say, where it would be easy to tip into a spiral that could overwhelm our capacity to deal with the virus. We could run out of space for isolation and quarantine, or we could inadvertently spread the virus into the local community. Either of those scenarios would mean that we have to continue or perhaps even tighten current restrictions. We have to clamp down now to have a chance to get back on track for all of our sakes. I know this isn't easy. This is what hard looks like. Getting to the other side of this will take all of us making smart and responsible and selfless decisions every day. The days ahead will test the character of our community, and I implore all of you to do the right thing. We know from the last semester that we can do this. I hope and trust that we'll look back on these 10 days as the time that we recommitted ourselves and summoned the strength necessary to keep this pandemic at bay. The last thing I'll say is this, especially to our students. I'm sorry you've had to sacrifice and endure so much. And I'm sorry especially for those who have worked so diligently to follow the rules and now are being asked to sacrifice even more. I'm sorry that COVID has disrupted your college experience in a way none of us could have anticipated or wanted. College life is supposed to be engaging. It's all about forming new friendships and having new experiences together in person, not from a box on Zoom or from behind a mask. This pandemic has put us sometimes in the difficult position of having to make choices for our collective physical well-being that has put an extra burden on our mental and emotional health. I wish we weren't in that position. And I'm sorry for the burden COVID has placed on all of you and on our faculty, staff, and Charlottesville neighbors as well. But I believe that we can turn things around if we remember that we're all bound together, if we remember that each of us affects what happens to the other, if we remember that it's not just about us as individuals, but instead it's about our entire community, which includes our Charlottesville and Albemarle County neighbors who are also affected by the decisions we make. I have every hope that next week will help get us back on track. If things start to improve, we'll do what we can to get closer to as normal as soon as possible. And I honestly believe we can get there together. I know we'll never get there apart. With that, I'd like to turn things over to Dr. Mitch Rosner, the Henry Mulholland Professor of Medicine and Chair of the Department of Medicine, and Dr. Kosti Seafree, Director of Hospital Epidemiology at UVA. They are, I should say, true heroes in this entire episode. And on behalf of the entire UVA community, I'd like to thank them both.
Thank you, President Ryan. I'd like to share a couple of slides that really maybe gives the community some information on the data that we look at in order to make decisions. I want to start off at the state level, and this is data that's widely available and comes from the New York Times, and it shows that at the state level, actually things were doing pretty well. The number of cases over the last 14 days at the state level had actually decreased by about 25%, and the state level data was encouraging. Unfortunately, when we dive down to our own health district, this is the number of COVID-19 cases data as of yesterday. You can see that in the last couple of days, there's been dramatic spikes within the health district that are really attributable to the cases that we are seeing at UVA, as I'll show you in a second. In addition, we look at test positivity, and this is the current 7-day positivity rate of PCR testing that's done in the Blue Ridge Health District. Early on, we had saw a couple of weeks ago that test positivity rate had fallen to a very low number. In the last 7 days, again, that test positivity rate has significantly increased, as you can see on this graph, and currently resides at 3.9%. Now, if we look a little bit closer within that health district in Charlottesville, this is again data from the New York Times, you can see that there's been a dramatic rise in cases within our community. Over 14 days, we've seen a 300% rise. Now, the data from the New York Times, I just want to caution you, if you're comparing data between different sources and our own COVID tracker, may look somewhat differently, and that's because there's a time lag. The COVID tracker has probably the most up-to-date data that you'll see. Some of the other data that's reported in other venues may lag up to several days behind that. But you can see that really there's this dramatic rise in cases in our community that began about a week ago or so. Now, looking at our own COVID tracker, you can see both the positivity rate in our overall population, students and faculty and staff, showing that once again, really beginning about a week or so ago, we saw a dramatic rise in cases. Typically, we had seen case numbers at most in the fall semester in the low 30s was a very high level day. In the last week, we have seen case numbers that peaked above 200 per day. In addition, the positivity rate, as I'll show you, this first of all is the 7-day average of 4.19%, also spiked significantly. That's a measure that tells us that this is not just due to increased testing. The number of positive tests certainly will increase as we test more, but the overall test positivity rate has gone up as well. If you look on a daily basis, this is the daily COVID-19 test positivity, you can see that that ratio also, that percentage also really began to spike around the 13th of February and has remained high and much higher than levels that we had previously seen, which typically had been below 1%. We also saw a very wide distribution of cases. And this gets to something that President Ryan mentioned and that I'll come back to. When we see this level, this distribution of so many cases throughout both grounds and off grounds, it gave us a significant amount of concern. And just to mention that approximately 75% of the cases that we are seeing right now are located off grounds. But contact tracing in our analysis of these case distribution did not identify a single or even a few dominant sources of transmission. Instead, it pointed to widespread issues with adherence to our public health measures. That was the major issue. In terms of isolation and quarantine space, again, from our dashboard, quarantine space is at 49%, isolation space at 21%. I will note that the absolute values of our quarantine and isolation space somewhat changes per day. We do have plenty of space available, and we have the ability to flex that space and find additional space if needed as well. Then I want to just touch on our own UVA hospital capacity. Currently, there are no constraints on capacity. Of note, we've now within our community cared for over 1,100 patients, including over 500 critically ill patients. And you can see, thankfully, that the number of new hospitalizations in the last couple of weeks has also come down. Also, thankfully, we have not seen any students developing serious illnesses or requiring hospitalization. Now, I want to comment, and I'm sure Dr. Sifry may add to some of this in the question session. In partner with VDH, we have identified the UK variant at UVA. Note that the capacity to sequence viral genetic materials is very limited at the state level, and we can't give an overall prevalence data for this strain right now because of that limited testing capacity. However, we do expect those influence of the variants to grow because we know it's present in our community, and we've heard from the CDC and others and the experience in the UK that they will play an increasing role in cases all over the country. Of note, recent data also points that not only being more transmissible, but also likely associated with more severe illness and potentially a higher risk of death. It's key to note that this variant really ups the ante. It will find the cracks in our armor. It's more likely to infect those people who aren't following the guidelines. It's a good wake-up call for all of us. Have you edged closer than 6 feet? Has that mask slipped below your nose? And really, it points out, despite pandemic fatigue, it's really not the time for slacking off on these public health measures. So what prompted the decision for short-term restricted operations? Our group of public health experts, which meets daily and reviews data, unanimously recommended that there were modification of operations occur. We were seeing a dramatic, more than a 300% rise in cases that was sustained, and it was widespread over several days. That suggested numerous transmission events that were likely continuing. We also saw continued cases that were occurring despite aggressive testing and our efforts at isolation and quarantine around these outbreaks. That was something that was different from the fall semester, where when we rapidly isolated and quarantined, we saw rapid falls in the case numbers. We also detected a more transmissible UK variant strain of COVID-19, and we also saw that the higher rates of students in quarantine were also turning positive for COVID-19, suggesting, again, more transmission. As you can see, there was greater use and pressure on the capacity of isolation and quarantine space. And very importantly, while we have not identified cases in the surrounding community that are linked to this rise in the university, we definitely need to ensure the safety of everyone in our community. And this remains a really highly lethal viral disease. Last comments, we're learning as much as possible about the routes of transmission, and we're targeting these areas of risk. There are likely numerous small acts of letting down our guard that lead to this increased transmission. The flattening of the curve will protect us all, will protect our community, and it does require a concerted effort to follow the public health measures. We know these measures well, and we know they also work well. So with that, I'll conclude, and thank you very much.
Thanks, Mitch. Kosi, did you want to say anything, or do you other questions? What's that?
I'm okay right now.
Okay. All right. So we already have a lot of questions. Ones that we can't answer here, we will do our best to answer on the website. So the first is, how will you make the decision to lift the restrictions, and then what happens if we get to next Friday and numbers haven't improved? I'm happy to start, but I think Mitch and Kosi, you can draft in. So essentially, we're looking at a lot of the factors that we looked at to impose the restrictions in the first place, and that includes absolute numbers, positivity rate, how the cases are distributed, isolation and quarantine space. We would like to see improvement in all of those areas. And if we don't, and the numbers haven't improved by next Friday, we're likely to have to continue the restrictions. I very much hope that we do not get to that point, and that we're able to flatten the curve a bit. Mitch and Kosi?
I'll just add that I think that based on our experience with the virus, we would anticipate that we should see improvement by the end of next week if we do follow these safety measures that we know work.
Yeah, and I'd like to maybe add that we know we can do this, and we know the measures that do work. So I hope that there's some sense of optimism that we can get this, but we are watching those values that President Ryan mentioned very closely.
All right. The next question is, have you considered moving to some sort of phased approach with benchmarks that would help the university community anticipate to more or less restrictive phases? I'm happy to start again and then turn it over to others. This has been a subject of conversation from the very beginning, and we have toyed with possibilities. The reason that we haven't is because of it's really the interaction of a number of different variables, and it's also not just about a current state, but about trends. And so it's difficult to pinpoint benchmarks that would be reliable. So it is about the positivity rate. It's about absolute numbers. It's about the spread of the virus. It's about our hospital capacity. It's about isolation and quarantine space. And it's about how those variables are interacting and where the trend lines are. And that's difficult to convert, although we've tried, it's difficult to convert into precise benchmarks that would be reliable. And there is inevitably some level of judgment involved as well. Mitch and Kosi, anything else, or is that okay?
Yeah, I think that's spot on.
Okay. I think this is a question for Alan. How does enforcement work, and have you actually enforced any violations of COVID policies?
Yes, so for well over 50 years, the Board of Visitors of the university has delegated the authority to discipline students for violation of the standards of conduct to students through the University Judiciary Committee. So that is the body that, as Jim said at the outset, has been working unbelievably hard this year to hear and adjudicate and sanction violations, whether it's by individual students or by student organizations. That's where our office investigates reports and complaints and then files with the University Judiciary Committee, and they have a hearing and sanction. The standard that is imposed is beyond a reasonable doubt, meaning that a violation must be shown beyond a reasonable doubt for a sanction to be imposed. We do have in our office the authority to interim suspend a student for an egregious violation. We did impose a number of those in the fall, which has to do with a suspension immediately from the university that then stays in place until the student gets an expedited hearing before the UJC. Many of you may have seen what the UJC put out, which was a summary of sanctions from the fall. One caveat with that is there's a lag in that a number of cases that we filed late in the fall were not heard until January. And so there will be sanctions that were imposed in January that apply to violations that occurred in the fall. And the last thing I'll say is we have brought cases for COVID violations against a number of individual students and also student organizations, including 5 of our fraternities.
Thanks, Alan. You are now testing everyone weekly instead of the frequency in the fall. Why is there a surprise with the increased counts? Mitch, you touched on this a little bit in your remarks, so why don't I turn this one to you?
Sure, and Kosti, feel free to add in. So while that's expected, it's really the percent positivity, and you can see that dramatic rise in percent positivity that went up from less than 1% to nearly 5%. That shows that not only is it just the increased frequency of testing, we're actually seeing a lot more cases, even controlled for that. And I don't know, Kosti, if you want to add anything to that as well.
Yeah, no, I think that captures it. And understanding that there is also an incubation period as well, that, you know, an exposure that occurs today may not manifest as a positive case until 5, 6, 7, 8 days from now. So this also is, we're going to anticipate that we'll be seeing these for, you know, the next several days at least.
Tyson, I think this one is for you. What's the advisory group on vaccines doing to help members of the Charlottesville community get vaccines?
Really good question, because you know, the vaccines will ultimately be the way that we really turn the tide on the pandemic. And so it's very important that we achieve a couple of goals. One is to vaccinate as many people as quickly as possible. The other goal, however, is to make sure that we're doing it in an equitable fashion. So some of the work that the advisory group is working on, there are 3 main pillars. The first one is messaging the community, and that means providing actionable, easily digestible information in multiple languages for our diverse community, so that people can have the information that they need to correct some of the misinformation that's out there, so that people can understand how the vaccines work, what they can expect, and how to sign up for the vaccine. Paired with that is actual access to the vaccine itself, because access can be an issue for a lot of folks in our community, particularly those who have traditionally had low access to healthcare. And so while we do have large vaccination sites that are up and running, we want to make sure that the community actually has access to them, even if there are barriers to get to these locations. And so we're specifically looking at doing equity focus clinics that are in communities that are of high need, again, pairing it with an information campaign to make sure that we're giving people the information that they need, but also giving them the access that they need in order to get vaccinated. And then the third piece of this is really working to make sure we have a good data collection system, so that we can understand who's getting access to vaccines, who's not getting access, and we can kind of fine tune our approach as our ongoing effort goes on, again, to ensure that not only are we achieving speed, but we're making sure that we're protecting the highest risk members of our community. So really those 3 main efforts that we're working on.
Great, thanks. I think this one is for all 3 doctors. What's the effectiveness of current vaccines, Pfizer, Moderna, J&J, in preventing hospitalization and death?
I'll go ahead and start, and Mitch and Tyson, free to join. So the 2 currently authorized vaccines that are produced by Pfizer and Moderna that were being used in our community are very effective in preventing not only disease, but in you know, specifically also hospitalizations and deaths. So 95+% effective in preventing those important outcomes. And Importantly, that's not only been borne out from the clinical trials, but we're gaining more real world experience in countries like Israel, where the vaccine rollout has occurred quite effectively, where we're seeing those same types of efficacy rates for wild type virus that are occurring, we're circulating in those communities. So we anticipate that we will be seeing that effect as well here. And in fact, maybe some of the early signals that we're starting to see in terms of case rates and hospitalizations and deaths that are occurring now may be in part a reflection of some of that vaccine efficacy. Is now more than 10% of the US population has received at least one dose of vaccine. In our community, it's actually quite a bit higher. I think the open question is, what about the new variants? So, focusing on are the currently licensed vaccines, and the Moderna, or not licensed, but authorized vaccines, the Moderna and Pfizer vaccines. Looking at the most common variant that we're seeing in the United States, the so-called UK variant, the V117 variant, those also appear in the test tube to be effective against those variants when measuring things like antibodies, specifically neutralizing antibodies. Maybe some slight reduction, but thought perhaps not to be a change in terms of efficacy, and you would predict also not hospitalizations or death. And that also is being reflected from what we hear in early reports of the use of the Pfizer vaccine, as well as an AstraZeneca vaccine in the United Kingdom. So good news there. The more concerning issue is the so-called South African variants, or these other types of variants that have a concern for immune escape, where they potentially have the ability to essentially get around the existing immune system responses to COVID, whether it be from natural infection or from a vaccine. So there has been demonstrated both in the test tube, depending on which vaccine you're looking at, but also in the clinical trials that have been performed in South Africa, reduced efficacy for prevention of disease with that strain called the B1351 strain. However, the good news, the silver lining, is that it would appear that some of these vaccines, and I'll highlight the Johnson & Johnson vaccine, which is currently being reviewed by the FDA, appears to still prevent hospitalizations and deaths, even though it may not be quite as effective in preventing disease. So it's sort of a mixed picture. We anticipate the variants are something that we'll be dealing with, moving forward. And they may come in sort of two general flavors. One may be more, some may be more infective, others may be able to get around components of the immune system. There is the potential that there may be a combination of both. I think this will be an ongoing story that may require, for example, revised vaccines in the future. But right now, I think the important answer is that the vaccines, as Dr. Bell said, they're widespread deployment is our best effort and what we'll need to really get over this pandemic.
This is actually
go ahead,
a question I've received a lot, because we can anticipate having the Johnson & Johnson vaccine, which I expect will be authorized, but does have that lower efficacy number. I think a couple of things to keep in mind is that when it stacks up against, just like Dr. Seyfried said, for hospitalizations and people dying of COVID-19, they're all quite effective. So even in South Africa, where we had those lower efficacy numbers for the Johnson & Johnson, it was still quite effective at preventing people from going to the hospital. And I think if we can turn a virus from a potential killer to a nuisance, then that's still a win, and that can still break the back of the pandemic. The other advantage to the Johnson & Johnson, that it's one shot. So if you have a fear of needles like I do, I'll freely admit that, it's a very good option. So we can anticipate that might be an issue if people are looking at just those numbers compared to one another. But the bottom line at the end of the day is all three of them are great candidates and would be great to receive.
Great, thanks. Mitch, did you have anything to add, or are you good? Okay. JJ, I think this is for you, though Mitch had a slide about this. Do you have sufficient isolation and quarantine capacity to support the recent rise in cases?
Yes, we do, and we have the ability to flex up to meet the needs. So we continue to monitor it, but yes.
Okay. I think this is for some combination of Mitch and Liz. Why are graduate students required to have the same mandatory testing as undergraduates?
Want me to start, Mitch, or do you want to start?
Why don't you start, Liz?
We want to test everyone actually, but we sort of had to draw the line somewhere. So we drew it at, we're testing all students. Graduate students are testing positive. They are actually testing at higher positivity rates than the faculty and staff who are voluntarily testing. Many graduate students live, study, and socialize among or alongside undergraduate students. So there's not really a Chinese wall between graduate students and undergraduate students. So those are some of the reasons. I think Mitch can talk about testing strategy overall.
Yeah, I think that's right, Liz. We wanted to really, we're going back to our philosophy in the fall. We want to be able to put a wall around the virus as much as possible, and that requires testing, rapid isolation, and quarantine. So the ability to test as many people as possible and turn that around as fast as possible is really part of any containment strategy. We also really wanted to protect the ability for students to be in the classroom. And that means both graduates and undergraduates. And that testing strategy is really important in protecting the safety of the classroom environment, whether you're an undergraduate or you're a graduate student.
Great, thanks. I think this one might be a combination of JJ and Mitch. Why were gyms and libraries closed as part of the recent restrictions?
JJ, do you want to start, or you want me to go ahead?
You can start and then I'll add in.
Yeah, again, based upon the information that we were seeing from things like contact tracing, meeting with various focus groups, we really wanted to address any weak links in transmissibility to find out where people may be congregating. And at a start, we wanted to try to contain this virus as quickly as possible so that we could return things back to normal. And while we don't want, we understand the burden it is on students, we also really want to clamp this down as quickly as possible to try to get things back to normal as fast as possible. And so that was in large part the logic around closing things like libraries and gyms, recognizing again that it does have a burden on the students, that hopefully it would be very short-lived, and that we could get past this next week and into a place where we can then return back to things where there'd be more normal operations.
I think this one is for Alan and Liz. Or JJ, did you have something to?
No, I think it's just a place of gathering, and we're doing everything in our power to stop the spread. And we recognize the hardship, but that hope by minimizing gatherings in these facilities, then we can stop the spread and reduce the restrictions as soon as possible.
Okay, thanks to you both. I think this is a combination of Alan and Liz. Is there an effort being made to expand mental health resources for students that may need extra support due to the current restrictions, i.e. CAPS or Women's Center, et cetera?
Alan, why don't you start?
Certainly. So yes, the Counseling Center is part of Student Health, which is part of the Student Affairs Division that I'm in as well. And I can tell you, I spoke with the director of CAPS a couple of days ago, and while there's a perception sometimes that CAPS is fully booked or you can't get with somebody, in fact, I'm told that they continue to have open slots and the ability to connect with students right away. So there is a lot of this that's being done by telehealth right now. But the importance of CAPS really can't be understated, that a student can contact them and try to get access pretty quickly to be able to talk to a counselor about the things that they're feeling. I also would say that with respect to checking in, those of you that are parents that are on this Zoom, checking in with your children occasionally and seeing how they're doing and making sure that that line of communication stays open. There is no question that COVID, this goes back quite frankly to this fall when we first came in, does create more isolation, does create more feelings that you're kind of alone and you're sitting in front of a screen and you're not engaging as much. And obviously going through what we're going through right now with the rise in cases and these restrictions makes it harder. But what we have encouraged our students to do is look for these opportunities to, even if it's virtual, connect with friends, connect with loved ones, keep those lines of discussion open as we try to work through this and hopefully get the case count down soon. But CAPS, as I say, the bottom line is CAPS does have the capacity to hear and see people. We also, as was noted, have counselors in the Women's Center and also in the Sheila Johnson Center in the Education School.
I think the only thing I want to add to Alan's excellent statement is One of the really wonderful developments in the last 10 to 15 years is reduced stigma around mental health challenges. I think that's a wonderful development in our society. And I would encourage any of you who are feeling very isolated and very alone to just make that call to CAPS or make that call to a family member or a friend and tell them how you're feeling. And just as Alan says, this period of isolation is just incredibly difficult for the human animal, which is a social animal. We like to be with other people. So I just want to make a personal plea to overcome any fear or shame or stigma that you might have about feeling lonely, feeling depressed, feeling very anxious, and really reach out.
Thanks to you both. I think this is for Doctors Sifri and Bell. What role will the university have in vaccinating students?
I'll go ahead and start, and Tyson, you can follow up. Taking a step back, I think it's an important thing to emphasize that as a public health emergency, the vaccine distribution is being directed by the Department of Health. So the allocations, the priority groups, that ordering is being set by the CDC and being executed upon by the Virginia Department of Health. And UVA Health is here to help with that effort in any way that we can. And we've devoted ourselves to be able to work on that as quickly and as possible. Both through large mass vaccine campaigns that you are probably aware of, and also as Tyson highlighted earlier, the outreach campaigns and efforts that are directed to communities of need. These are all efforts that are done very closely with the Department of Health. So when we ask when a group will be vaccinated, it's really going to be determined by the Department of Health. So we could anticipate at some point that we are going to see increasing vaccination of people who are aged 16 to 64 that have pre-existing medical conditions. And clearly there are going to be some students that fit in that category. When that occurs, that vaccination, at least some of those vaccinations are going to be provided by UVA Health at our vaccine center in Seminole Square. There are going to be those types of efforts. If we're talking about a more broadly available vaccine, I think again, time will tell, but it will be contingent upon vaccine resources for the entire country. And I'll let Tyson answer anything else.
Nope, I didn't have anything to add to that.
Okay, all right, thanks. I think a number of you, including Tyson, Kosti, Mitch, and JJ, could talk to this next question. How are you collaborating with the Charlottesville community in the face of this increase in cases?
I'll go ahead and start. I think, as Mitch said earlier, that what's been a fortunate thing thus far is that we have not seen that the impact of cases has not led to students being hospitalized. But that's something, of course, that we're very concerned about, and an important reason why we need to act now. Also, we need to understand if there's any potential for the impact of COVID within the university to have on our broader community. So we work closely with contact tracers to understand what the interactions are between students and with the community at large, and to have those understanding. There's parts of the UVA community that have overlap with the rest of the community. And so as part of that contact tracing effort, we are here to work to make sure that we have effective mitigation strategies in place. And of course, it's really important to have active lines of communication open between the Department of Health and with the contact tracers, and with those of us who sort of have this public health role for the university, and to have that on a essentially a daily basis.
I think the other thing to add is that being a good partner to the community means that we're using the community leaders that have been doing a lot of the work that's been taking place before COVID-19 and really using them to really reach the community. And in particular, the changing the model of medicine where we actually go into communities is really the name of the game when it comes to COVID-19, when it comes to public health messaging, making sure people have the resources they need, and ultimately getting the vaccine rolled out. So I can tell you that our advisory group is making sure that we're working with community leaders, taking their lead, giving them a seat at the table when it comes to how we're planning events, how we're publicizing the events, and making sure that we're doing it in the right way that ultimately serves them in true partnership. So, as this crisis goes on, our hope is that we just continue to reinforce those bonds, but that we really use it as a chance to change our relationship going forward to improve health globally.
Thanks to both of you. Mitch, I think this is for you. Why do we have faith that we'll not get a resurgence of cases the moment restrictions are lifted?
Well, part of the basis of restrictions is really to flatten the curve. But after we flatten the curve, the key thing is really going to be for all of us to maintain that vigilance, those public health measures going forward. That's going to be the critical thing. This is not a short-term wear your mask for the end of the week, and then when the case numbers look better, we can go back to business as usual. This is really a wake-up call for all of us that we have to really adhere to these public health measures on a continuous basis. If we do that, we can be successful. But flattening the curve this next week or so is really to get those case numbers down, get us back into a position where we can be successful. But that success is really dependent upon us continuing with those public health measures as we go forward. If we do that, we'll be successful.
And I've got another one for you, Mitch. You talked about this as did I, but a little in your remarks. What do you think are the contributing factors to our university-specific case numbers, and why are other universities not facing similar rates this semester?
So the second part of that question, I'll just point out that many other universities, many other universities are facing similar problems.
Right.
I think there's a lot of issues, not the least of which is fatigue around COVID. I think President Ryan mentioned this in his opening remarks. This has gone on now for a year, and we recognize that people are tired. They want life to come back to normal. And as part of that, I think we have let our guard down. It's, I think, not surprising. I think when we've looked at the cases and we've tried to understand where the increased transmission is, it's not one single event. It's not a super spreader event. It's multiple small events that have really contributed to this. I think that's borne out when you look at the widespread number of cases that we're seeing across grounds and off grounds, which is very different from what we saw in the fall. All those things really have repeatedly pointed out to us that this is multiple small events throughout grounds that are and off grounds that are contributing to this, and really highlights once again that we've got to do better. We need to really double down on those measures in order to clamp this down.
Thanks. Here's a question for both Liz and Mitch. If there are this many positive confirmed tests, why aren't you canceling in-person classes to stop the unconfirmed asymptomatic cases?
Liz, do you want to start
I'll
off?
start and I'll chime in, or
Oh, what? You go ahead.
no, you go ahead.
Okay. Well, I think one of our things that we've looked at very carefully, and this goes back to the fall, is whether we can identify if there have been outbreaks around any particular class is. And after our analysis and continued analysis, as well as contact tracing, we don't see the in-class environment as something that is a particularly high-risk environment. We also really view that as something that's part of our mission and something that's really important to students and to faculty. So recognizing that it's a very low-risk environment, that we're not seeing anything on our radar screen from contact tracing that points to the classes as being a problem, we would like to be able to continue to offer that. I'd also say that it's one of the most controlled environments we have. It's one where everybody clearly is wearing a mask and its distance is really controlled. So I think we feel comfortable with that environment as being one that we can continue to protect and move forward with.
I'd add one thing which I've learned from Dr. Rosner. So the one area we had some concern around is something we're working on, which is queuing and grouping together in the ingress and egress of the classroom. And the operations team has been working on that and making clear that students should be distanced as they come into the classroom and that they exit the classroom in another place. I think we have set up plans in 44 classrooms specifically to put up signs about that and to try to increase the monitoring, just to remind people that they shouldn't be bunching together and grouping. That was the one area identified by the docs as something we should look at, and we were doing that.
All right, thanks. We've got time for a few more questions. This one I think is for Alan and for JJ. Now, why are students expected to monitor and report each other rather than the university paying attention to what happens on the corner and at Greek houses and stopping maskless partiers directly?
I'll take a crack at it and then turn to Alan. So first and foremost, it takes all of us. So we do have RMC ambassadors who are asking students to mask if they are unmasked and providing them masks, and also reporting non-compliance. So if there is any grouping of individuals or people who are unmasked, we also have a UVA police department if there are serious issues or incidents. In addition to that, as we've said, we have asked for full accountability to hold each other accountable, and we have a safe grounds reporting location. So if there is information or events, we can also, we ask everyone to help ensure the accountability. Alan?
Yes, I think all I would add to that, JJ, is, it requires a community investment, right? So there are things that our police officers may observe, and they report those to us, and of course deal with them in the moment they're seeing them. The ambassadors play a certain role in that respect as well. But then we also need community members, because there's only so many people that work for the university. They can't be everywhere all the time. And what we find is our students, because they're living in the community and engaged in the activities, tend to be the best sources of being able to put in a report and say, I'm concerned by what I saw, or by what I observed, or by what a friend told me. And that then targets our investigations. Otherwise, we wouldn't know some of these things had happened.
Thanks. This one I believe is for Doctors Bell and Seafree. What role does the university have in determining vaccine eligibility and helping with distribution?
So really zero role when it comes to determining who's eligible for vaccine. And that's because we're a university, we're not a health district, and we're not a public health department. So the Blue Ridge Health District and the state is helping to determining who's eligible for vaccine, and we're taking our lead from them. When it comes to distribution, we are coordinating very closely with the Blue Ridge Health District to provide resources and logistics and whatever we can when it comes to helping to vaccinate. So for example, there are two large sites in the city right now. They're at the Kmart at 29 and Hydraulic, that's being run by Blue Ridge Health District, and we're sending people to help with the vaccine there, administering vaccine. There's another site at Seminole Square that's being run by us, but again, at the under the direction of the Blue Ridge Health District as to who qualifies for vaccine. And so we're in lockstep with them the whole way. We're trying to be a good friend and partner.
Kosti, do you have anything to add?
I'll highlight that we've provided our over 40,000 vaccine doses since the onset of our vaccine efforts. And at this point, I think around 25% or more of all citizens in Charlottesville have been vaccinated with at least one dose, and it's around 15% or higher in the county. So we are trying to be the lever arm for the health district to roll out vaccine for our region.
Well, thanks to you and others. And I know it's been a heroic and Herculean lift. JJ, this is for you. Do you plan on continuing telecommuting for staff for the foreseeable future?
Yeah, so telework is strongly encouraged wherever we are able to accommodate that. And we have strongly encouraged that and asked for flexibility with our managers and our leaders. I would point out that we are a 24/7 operation, and a debt of gratitude to our essential workforce as our health system, our facility, and police. So there are some that are required to come to grounds, and we have provided additional PPE for those individuals, but we're deeply grateful for those that have to come to grounds every day.
Is there still a chance for on-ground students to be sent home for the remainder of the spring semester? I'm happy to start, and anyone else can add in. Our serious hope is never to reach that point because that carries risks in and of itself. There's always a chance. I mean, you can never say never, but that would be the very last measure that we would use, again, because of the risks of sending students home. Mitch or Kosi? Okay. Why are students who have been carefully following the rules being punished for the bad behavior of those who have violated them? Mitch, I think what you said earlier is probably a good answer to this, but I will turn this to you.
Yeah, again, I think it gets to what data that we're seeing. It's not one or two large super spreader events. The data supports, and what we've seen from contact tracing, again, comes down to the fact that there are many different events. There are small events that are occurring on grounds and off grounds that are leading to this widespread transmission that we're seeing.
I would also add that although I know it might feel like punishment, that is certainly not the intent. And for the reasons that Mitch has explained, it's important that everyone's involved in this, just like it's been important all along for everyone to follow the health and safety protocols. Sometimes the sacrifices fall harder on some than others. Liz, did you want to add something?
Well, I feel this concern. I guess if you think about it, this is the nature of a contagious disease. I mean, from the beginning of the pandemic, as we adopted public health measures, all of us, on behalf of all of us, were following them. So these restrictions are really difficult to deal with, but it's the nature of what we're fighting. That is, we all affect each other.
Yeah, just to add a clinical perspective, I work in the ICU. I'm covering the COVID ICU right now, actually. And we have patients who come in, very sick from COVID-19, but they were doing everything that they were supposed to do. They were wearing a mask when they went out or avoiding going outdoors. They were physically distancing. They were, being very, very cautious and safe. And in some way or some other fashion, they came down with the coronavirus. And what that really means is when cases go up, we really have to try globally to bring down the chance that it'll spread to others. So the nature of the virus, as like Liz said, is that it will spread if we're not doing mitigation measures.
Okay, we have time for one last question, and that is, what plans are being made to have students back to all in-person classes for summer and fall? And I'll hand that one to you, Liz.
A question at the forefront of everyone's mind. We're thinking about summer right now, and also looking forward to fall. We have made a preliminary decision on fall that our expectation is that we will be in normal operations, but of course we will be ready to pivot if we need to in the summer to change our plans. But our sincere hope is that we can have a regular fall with students in the classrooms, but we'll be ready to pivot if need be, if the safety requires it. We have delayed registration a bit, consistent with what we did last spring, so that faculty can take advantage of a little bit extra time to think about the fall, which is a good thing, and students were pleased with the timing of registration last spring. So that will also allow us a little more time to plan.
All right, thanks, Liz. The hour is up, so let me thank everyone who participated on this call, and to everyone in the audience, especially those who asked questions. We will do our best to answer ones that we weren't able to get to. We will also continue to hold town halls throughout the semester, continue to keep you as up to date as we possibly can. If you have advice about how we can best reach you, we are all ears. But for now, thanks to all of you. I remain confident that we can get through this. We did it last semester, but it is going to require that we all act together and act with grace and compassion. Thanks very much.